Local productions seen on Delta College Public Media are made possible with support from viewers like you. Thank you.
Hello, everyone. Welcome to Junia Doan's The Spark. I'm Junia Doan, and thank you for joining us. My guest today is Dr. Wilma Siegel. Following a prominent career as an oncologist in New York City with an early focus on hospice, Dr. Siegel turned to the visual arts. She is now a prolific watercolor artist specializing in moving portraits. Welcome, Wilma. Wilma, I always wonder how people pick out a field within the broad range of medical study. How did you come to the selection of oncology for your specialty?
When I was 7 years old, I said I was either going to be a doctor or an artist, or on both. And as I went along, my grandmother was dying of cancer, and I decided way back when that I was going to cure cancer and find the answer. And so I dreamt of maybe being on the cover of Time magazine for the ultimate cure of cancer. And in my day, there wasn't such a field as oncology, and I had to figure out how I was going to do this. So I think my artistic skills allowed me to figure out how to do things. And I studied in college pre-medical because I wanted to be a doctor. And then I finally got into medical school. And in medical school, I did a seminar on cancer chemotherapy, which I thought was going to be the answer. That was in the 50s and 60s when the beginnings of the field of oncology was happening. And in my seminar, it turned out in medical school, I knew more than my teachers. And when I went to the cancer clinics, I was telling them what I thought should be done. So I knew all the agents and I understood it. And having done that seminar, I figured out who I wanted to learn cancer medicine from. And that was David Karnofsky at Memorial Sloan Kettering in New York City. And I made this happen, and that's what happened. And I learned from David Karnofsky, who I consider the father of cancer medicine oncology. And he founded my job at Einstein Montefiore, where I helped to develop the oncology department in its days.
How do you promote and establish trust from a patient to a physician, such as yourself, in a new field?
Well, it isn't. It's a new. When you learn basics of taking care of people, it's understanding the individual so much. And I'm very good at listening to people. And I have major eye contact when I listen because the eyes are the mirror of the soul of the individual. So I try to figure out really what are they thinking and what is happening there. And I use my empathic skills to help them.
What is there a difference between what they're saying and what you're reading through their eyes?
I think it's a matter of listening to their stories and understanding what is really happening in the spark of the eye. You know, I'm a portraitist and I really understand anatomy. I understand what goes on in the human body. And it's actually it's a mind-heart connection that happens between people when you have empathy.
What causes a person to start healing?
You know, in medicine, one of the most important things is giving trust to the individual. It's almost like love. I love my patients. I didn't always love who they were or what, because I've taken care of people that are not have not the kind of values I have. But I look upon human beings, and I try to get the trust of the individual because I care about them and I want them to have comfort, and that's the thing I try to give. Um, it's it's really by sitting and being there and listening. Um, there's a movie called Being There, which is a comedy. Um, it's from a book about being there, and that's what it is. Being there is understanding and kind of touching their feelings.
Rare in anyone, especially a physician,
I don't think
especially in someone with a forceful personality like yours, to have a whole other side that is,
I think it's part of my maternalistic part. You know, females that are have maternalistic feelings towards people. That's kind of, I look at people as wanting to give them comfort, and I think that's what mothers do. So
how do men develop it in themselves then?
they can, they understand if they keep. I mean, both men and women have similar feelings within them. We the hormones affect us, but men have a female side as well as a male side, and women have, I mean, females have a little bit of a male side. That's the aggression that comes out, the competition.
You taught in medical school for quite a while. What's the best way to teach students to become good doctors?
I learned from great mentors, people that knew their profession, practiced it with great dignity, and cared about their patients. And that's a very good bedside um, mannerism. I remember when I was an intern, extreme male chauvinism was happening, but I had an advantage too because I was a pretty woman. It worked, whatever. But I had an attending who was on the ward when I was in internal medicine, who was the number one physician in, this was at Mount Sinai Hospital in New York City. He was the one that had the celebrities, and he made house calls. And I was privileged to go on house calls with him, and I watched him backstage on Broadway, in the homes of very important people, whatever it be. And he was a great performer. He was a great salesman. And I believe some of what we do, it has to be sincere from your heart. And that was from his heart because he really cared about his patients. And we do have to have a little bit of performance. We have to sell good life to people.
I agree. The attitude of the physician towards a patient, sometimes that's all they have is the attitude of the physician. And there goes the trust, right? If you trust the doctor and the doctor says, there's hope, we can get hold of this and it's going to be rough, or this is what it's going to be like, or, we're taking chances here. It's team.
Well, I
It's almost
learned,
beyond words.
uh, Junia, I learned from wonderful mentors, and that's what I think good teaching is. You have to find the best and you learn from the best. And that's what I always sought. The best physicians that taught me in medical school, I wanted to imitate.
And what did you learn from your patients? Some patients.
Yeah, my patients were my best teachers because they taught me the diseases that I had studied. It's a different thing to read in a book and know it from real life. And my patients helped me in that way. We did it together. We had teamwork. I learned from
Even
the
then, that's remarkable.
I learned from the families. The families taught me. Not many medical doctors know what to do in the home, but my patients and my nurses taught me what to do.
They
The
give an
team,
example of that.
the team does it, and that was what when I my later part of my medical career, I helped to start hospice in this country, and we started teams. It was not it was all Courant then, which would have been in the 70s. Now we have teamwork, but true teams are working together and on an even basis, not that I'm the doctor and you're the nurse, but your profession is to touch and you're helping me learn how to touch. And my profession is to write the orders. So, where the direction that this patient is going, and we must do it together. It's not just me. Unfortunately, many doctors are trained to be godlike figures. We're not God, we're people. And we have to understand people. We have to understand the people we work with. And certainly, life and death situations, you have to work together, not against each other.
Could we handle death better based on your experience or the death experience? Or does it so
Um,
depend on situations and pain levels and spiritual commitments?
I think we can do better, but I think hospice has helped. My epiphany was way back when I was trying to cure cancer, and I realized I wasn't curing many. Everybody was sending me their dying patients, and they were passing the buck. And my feeling is it's not good to pass the buck. Continuity of care allows for more comfort. I went to a lecture given by Rene Dubose, who was the president of Rockefeller University, one of the most intellectual universities for scientific discovery in America. He was a philosopher, and the title of the lecture was Cure Sometimes, Console Often, a Comfort Always. And that was my epiphany. I heard that, and I said, in medicine, the truth is we should be comforting always, consoling often, and curing sometimes. That should be at the bottom of the list rather than the top. And the top of the list should be comfort. And that's how I developed whatever we did in hospice. There were other people doing it. I learned from Kubler-Ross and learning the stages of death and dying. And I learned from Cecily Saunders, who was the founder of modern day hospice in London at St. Christopher's. And I went to the Montreal Palliative Care Unit in Montreal, Balfour Mount, and I learned what they were doing. I began a pain team at Montefiore, collecting different disciplines of psychologists. I worked with an anesthesiologist to teach me pain management. I worked with a social worker because I had to learn how to do home care more. My nurses were a major part to teach me the comfort of touching the patient and learning how to give the comfort. And I went to drugstores a lot to learn what was in there and what we could do in the home, because most of death and dying should be in the home. What I had
Agreed.
learned much was that patients, when they were dying, would want to be at home, not in a hospital, not in acute care. They wanted to be with their family and be in comfort in their own home. So I had to learn what was home care, which I hadn't been taught very much in med school, but my team helped me learn it. And so we made a team of social worker and volunteers, and we had spiritual counselors that helped me learn how to communicate with the patients a little bit better. And if I couldn't do it, the spiritual counselor could help better. We worked as a team in all our major disciplines and expertise to work together.
So you were cross disciplined before that term was even widely used.
Exactly. Hmm. And I believe my art did that. I think the humanities teach us why we do what we do in life. I believe that should be an education primarily. It teaches us why we're human beings, and working with human beings, we should understand human beings. And major artists teach us that: visual artists, performance artists, musicians, poets, writers, whatever it be. So if you're dealing with human beings, we should learn all of those skills.
You write a lot or talk a lot about beauty and art as healing. You've established several programs for young children in a hospital setting, and maybe even a wider age group. That I don't know. But I've never read that you ever talked about music. How is it different, art and music, in
Well,
terms of the area we're talking about?
I'm certainly not a musician, but I learned having gone to several hospitals, and when the pain team at Memorial was developing, it was a little bit after I had started a pain team, so it was concurrent pretty much. I hadn't used music, but they used music therapists, and I watched what it did for patients. I find music is a very important part of hospice work. It's an important part to give us peace in some way. It's used very much in stress management. What happens? I mean, I'm not a neurologist, but what happens? They have had studies that when one, certainly in Alzheimer patients, music can change the whole attitude of an individual from anger to comfort and cheer, and they remember things better. But what happens when they do MRIs of the brain when you have music going is the entire brain lights up. So, rightfully, if you're using your whole brain, something is happening to help you in stress management, I would guess.
Is beauty spiritual?
Yes, and so is ugliness spiritual. It's all the human condition.
So is
Spirituality,
evil, but I was evil spiritual?
I think life is got positive and negatives, and we don't really know what positive is unless we have negative. So it's one of the things when I was a child, I said to myself about all this, negative, positive. I said, I want to go up, I want to go forward, I want to go to the right, meaning that I want good values. I don't want to go backwards, I don't want to go down, and I want to go and whatever. So that's the human condition. You make your choices. But beauty is in the eyes of the beholder, remember. So,
I wonder if it varies by culture. I guess it does somewhat.
sure, it does. Mhm.
I remember when they were building the IBM building in Madison in 57th Street, and I was in front of Bergdorf's one day, 58th, yeah, 58th and 5th. And I looked up and they had some I beams they were moving around, and just the juxtaposition of the couple of I beams. And I thought, that is so beautiful. It is
Yeah.
just beautiful. And I walked away with just what you expect. Find it, look for it, recognize it, celebrate it, enjoy it, be grateful for it. Because if you see it, it's everywhere, along with evil sometimes. But so uh, you got married in later life, maybe. What kind of a person was your husband, if I might ask?
Well, I don't know whether you can see if I move this. You might be able to see that
Oh, what
in.
a nice looking fella.
That's on the left, I don't, and on the right is a painting of myself. And that's watercolor. It's what I do. I do watercolor, which is the most difficult of the painting media. At any rate, he was an intellectual. Um, I was lucky to have met him in my life and shared joys of the world together. He was a very bright man who was very unpretentious. He went to Columbia University at age 15 and graduated at 19. And that was in 1949. In 1949, it has listed in history that we have the most CEOs in the country. Now, looking back on history, history is so important. It teaches us the future. My husband graduated with those men that had returned from war. And it was 4 years after the war ended. And those men had experienced a huge problem of death and dying. So they were mature and they knew what they wanted. And so he was in a class at a very young age with older, mature men, and I'm sure it affected him. And he excelled right away. On graduation, his father died, and he took over a family business, and he grew the business with visions that were quite unusual for his day. He grew it to an international company. He was a visionary. Everything he did was before people thought about it. And I honored that part of him, his intellect. He knew everything. I learned so much from my husband. But the visionary part of him is what I hold so much in my brain. He took over a working men's company. And what he did, he developed it each time our country was changing into something else. He saw the future, he understood the future, and he understood people. He had over 6,000 people working for him at one time and more so. He developed many things in the clothing industry. It became a menswear, and then it ultimately became a world jeans manufacturing company. He knew the times, what would happen in the times in the future, and saw it. When he took over the company, it was working men's clothes, and he knew that, having gone to college as he had, that the future would be a little bit of education. So he created what in those days, in the 50s, the chino pant. And that's what every Ivy League and college male was wearing, was a chino pant with a buckle in the back. I remember when I was in college at the University of Pennsylvania, that was the Ivy League look. And then as we changed into they had gone to college and they were going to be out working in white collar rather than blue collar. And we know the Madison Avenue Mad Men on television series. Their men wore suits, and they wore three-piece suits with a vest, ties, and button-down shirts and whatever. He created that. He did John Travolta's white suit. That was something that was big. But then he saw the future in the 70s where it was the war was happening, make love, not war, and the flower child is growing up. So jeans were a very important part. So everything became jeans, and then our country was into jeans. He made an international company that was in Europe, and that was very much throughout Northern Europe. And then in his own life, he liked toys, so he had the first jets that anybody had for business jets, and he had boats that people had never had. Now, when you're in Florida, as we are now, you see boats all over the place. Well, it was rare, but that's what my husband did. And he started the business jet business. So he was a man that saw the future and understood the future, knew about history, knew about everything, and he was a visionary from what he learned and who he was inside of himself. So I was honored to be with a man that was somebody that I looked up to, and we shared life together, and he adored what I did, so we shared, and I was fortunate.
You're very fortunate. First of all, your similar personalities, taking on the future where you saw opportunity and need. And I thought for yourself, the idea of switching around comfort, comfort, console, and cure, or at least make well, was a wonderful change. And you brought to life an ability to inquire about the future. You know, grandmother influenced you on the cancer side, but still on the hospice side and treating other populations, that's you, the big compassionate heart. And his, in his own way, was, what do I want to say, being there at the right time with the right thing. And that's genius in itself. So what I found out from you that I shouldn't pay attention to your side so much when you're gruff, but to recognize the tremendous breadth of humanity you have within you and that you bring to the important parts of life, your husband, your patients, to the projects you care about, and now, well, for a long time now, your art and finding the soul, finding the truth, finding the truth in your work with making portraits. Fantastic. Delighted to have you.
To contact Junia, send her an email at juniadonsthespark@gmail.com. For more information, program schedules, and news about future guests, go to www.juniadonsthespark.com. Thank you for joining us. See you next time on Junia Doan's The Spark.
Local productions seen on Delta College Public Media are made possible with support from viewers like you. Thank you.